Hey guys, so I'm hopping on. I know this is like a super long and anticipated update because I've been super busy and I've been meaning to make a video and just like the timing hasn't worked out. So yeah. So I'm just on here to update you guys. I'm still dealing with the symptoms. As you can tell, my face is very swollen. I'm super bloated. And so that's not fun. It makes me pretty miserable. So that's one of the symptoms that I'm still continuing to deal with. I pretty much am dealing with all of the symptoms, but for the most part, that's kind of like the main one. The biggest news I have to share is that the beginning of December, my PICC line came out. So my doctors took my PICC line out. I was scheduled to go to Disney World, and I told you guys that. But something happened with our trip, and the girl that we were supposed to go with, her grandmother had an emergency, so we weren't able to go. So we pushed our trip back, and we just went in March over spring break. So that was a lot of fun. I had a wheelchair rented. I only used it for about 2 days because it started to be more of a hassle than like a convenience. So, I mean, I paid like $150 for the full week, but I only really used it for like 2 days. It's so hard. Like, the parks, I mean, they were decently crowded, like, for certain things, but like, when people like jump in front of you, like, there's no brake on the chair. You just have to let go of the gas. And so you're like praying that you're just not gonna hit the person. So with like kids and stuff, it was really hard to like not hit people purposely. You know, that's not my intention, but people would jump like right in front of me, and like I would feel super bad because I'm like right on top of them. But anyway, so yeah, I only used it for like 2 days, and I'm like, yeah, forget this, we're not using it anymore. So I was able to walk for the most part. I did have some issues with the stimulator hurting, but nothing like too extreme. So, but to go back, the beginning of December is when my PICC line was taken out. So they took that out. I was like super emotional about that. It was like unexpected. So when it came out, I was pretty like overwhelmed and shocked, and was just hoping that like this was the right decision. Personally, I didn't really want to take it out at the time. Like, I knew my PICC line would needed to come out, you know, because it can only stay in for up to a year. I had mine for almost 8.5 months. And I'd never had a line infection, never was hospitalized for it. I was hospitalized one time for a scare, and they kept me overnight just for observation because I was running a fever, but my cultures didn't grow anything, so they sent me home. So my PICC line, I had literally no issues with my PICC line. Like, I was very blessed that I did not have any problems with it. I didn't have to have it taken out and put a new one back in, anything like that. Like, I had the same PICC line the entire 8 months with no problems. I mean, there was a few scares here and there of like some drainage near the site, so I had to go to the emergency room for that, but like nothing like super severe. Never went septic or anything like that, because a lot of people, their lines go septic. So I had that taken out. I don't remember the exact date. I think it was on a Wednesday. Yeah. I think it was on a Wednesday, because we were going to leave on that Saturday. So they took that out, and we ended up not going to Disney World. Well, then about 2 days before before Christmas, or 3 days before Christmas, I believe, I had the Botox injection procedure, and I had that done locally. And so they went in with the Botox. I had a surgeon from the hospital that I'm seen at. He was in there, and then my GI doctor was the one that performed the procedure. And I originally told them that, you know, I probably would need to stay overnight, just because of for the pain reasons, for the air they have to put in and stuff like that. But after the procedure, I was like, I'm ready to go home. Like, I just want to go home. So they let me go home. But the plan was for me to stay, and they already had like my paperwork and everything ready. And my GI doctor comes in, he's like, you don't want to stay anymore? I'm like, no, I just want to go home. So I came home after that, recovered for a few days. It really wasn't a huge deal, but I noticed nothing, no changes, nothing positive. In fact, I almost feel like my symptoms were a little bit worse. I was still having a lot of like the throwing up and the vomiting and that kind of thing, but there really was no like positive experience from it. So we decided that we're not going to do the Botox injections anymore. during the procedure, my GI doctor took several pictures, and he took pictures of the pylorus. That's what the Botox was injected into to try and help it to flow the food a little bit quicker. So he took pictures, and during the procedure, some of the pictures showed that there was a possible lead protrusion through the anterior portion of the stomach wall. And my GI told me, he didn't think it was an issue, he didn't think it was a problem, but he's not put in the gastric stimulator or anything like that. And my local hospital, they don't put the stimulator in. So Ochsner's in New Orleans is who put in my stimulator and who manages my settings and that kind of thing. So I brought the pictures to my surgeon because my GI doctor was like, well, I don't think it's a huge deal, but next time you go to your surgeon, just bring the pictures. So I followed up with my surgeon, let's see, the beginning of January. Yeah, the beginning of January. And I brought the pictures to him, and he was like, well, I don't have good news. And me and my mom were like, okay. Well, and I thought, they're going to have to, go in and, do surgery to move the leads around or something, or I don't know. So I showed him the pictures and everything, and he was like, well, this is not good news. And I was like, all right, well, what do I need to do? And he was like, well, this is a very rare complication, but this does happen, and because of the lead protrusion, he was like, I do not want to make any changes to the stimulator. I don't want to increase the settings. Everything is staying the same. We're not changing anything. So that was really frustrating. So after he told us that, my mom just kind of was like, leaned her head up against the wall, and we were just like, are you kidding me? So because of that, he was like, what we need to do is we need to schedule to have it removed. And I'm like, have it removed? Like, I haven't even had it a year. And he was like, because of the lead protrusion, it's a risk for an infection. So they have to completely go in and take the stimulator out, which is really frustrating, and I was devastated. So we have to take the stimulator out. It's going to be coming out at the end of May, so it'll literally be, I literally will have my stimulator for 364 days? Yeah, 364 days that my stimulator will have been in when I have my next surgery. So at the time of this surgery, they're going to go in and do a pyloroplasty. We just aren't really, happy with the results we were seeing from the stimulator. It's worked wonderful for the vomiting. I mean, I still vomit. I still have symptoms. I'm vomiting still weekly, but it's not every single day. So the stimulator has helped, and it has helped some with the nausea, but just not as much as we were hoping. The most frustrating part was that this whole time my surgeon's been telling me, okay, well, the gastric stimulator and the pyloroplasty together have about an 80% success rate. Well, now I'm not going to have the stimulator. So the pyloroplasty is about a 40 to 50% success rate by itself. So the plan is do the pyloroplasty and remove the stimulator at the same time. Now I know you guys are probably thinking, well, why can't they just put in another stimulator at the same time? Because that's the same question we asked my surgeon. So the reason they cannot put in a brand new stimulator at the time of the pyloroplasty is because when they go in and they actually are cutting a part of the pylorus, the gastric juices from the stomach can flow backwards and forwards. So they can't put in a new device because if it flows backwards, that whatever flows backwards can cause an infection around where the stimulator would be placed. So that's the reason why they can't do it at the same time. So we asked that, and that's what we were told. So the plan is to go ahead and take the stimulator out and then do the pyloroplasty. We're hoping to do a robotic pyloroplasty. We're still trying to make sure everything's going to be worked out with that. If for some reason the robotic pyloroplasty cannot be done, my surgeon will do it laparoscopically. So I'm still clinging to the hope of maybe we'll go into surgery and my surgeon will open me up and be like, oh, we can just tweak the leads a little bit and move them around and he won't have to completely take it out. So that's what I'm hoping for. So I'm hoping as soon as I come out of surgery that's probably going to be the first question out of my mouth is, did they take the stimulator out? But he didn't mention that. He didn't mention the option of tweaking the leads or anything like that, but I'm just kind of hoping that that might be the case, but we'll just have to find out. So, they gave me the information. We've scheduled the surgery date. Everything's set in stone. The typical stay for the surgery is 7 to 10 days. I'm hoping that is not how long I will be there, but I'm telling myself that, you know, if I'm there the 7 to 10 days, that I am, but I'm hoping that's not the case. With my stimulator surgery, I was there for 5 days. And the reason I was there was because I had issues with my heart rate. My heart rate was super elevated after surgery, and I was actually hooked up to a heart monitor the entire time that I was in the hospital. So that was one of the biggest concerns we had. And then the morning after surgery, I had some issues with like chest pain, and where they had to order like a stat EKG and chest x-rays, and like with a matter of like 2 minutes, I had all these doctors in my room. So, but thankfully everything was fine. They just think it was kind of just some pain from the simulator and that kind of thing. So, yeah, so that's scheduled for the end of, for like the middle of the summertime. So that's kind of frustrating. We're just going to have to play it by ear, but the plan is if that I go in, I have the pyloroplasty. If it doesn't work, 6 weeks later, they're going to go in and put in a brand new stimulator. So I'm possibly facing 2 surgeries this summer, for sure 1, maybe 2. I'm hoping just 1, but we will have to see. So I still am dealing with some pain, the nausea, acid reflux. I just went back to my doctor a few days ago for acid reflux, and she increased my medication a little bit. This is just like a list of my medicine bag. Like, this is just my life, literally. Sad, but it's the truth. I take about 15 or 16 pills a day. One of the prescriptions I take 3 pills 3 times a day, so that's 9 pills just right there for one medication. So I'm on a lot of medications, and it's a lot because I have doctors that prescribe it from a certain place, then I have doctors from another place, and then I have another doctor from another place. So I have to go to like 3 different pharmacies to get all my medications, so it's really confusing. But yeah, so they've been doing routine blood work just to check everything, make sure everything's going okay with like my nutrition levels. My weight is holding strong, around the same. I'm kind of twiddling up and down, but that's my usual. But they did talk about maybe possibly placing a J-tube, but as of right now, that's not the plan. So they mentioned it, but we're not planning on that right now. So we'll just have to kind of play it by ear. Let me think. I'm still dealing with the issues of the bloating. I'm on 3 different nausea medications a day, but I still have nausea. My biggest thing is just I have no appetite. So that's kind of like my biggest downfall, is that I have no appetite whatsoever. So there's also, I don't know if you guys know, but I'm on a lot of gastroparesis support groups and pages, and so there's constantly updates going on, different things that are coming out, different studies that are coming out. There's still a lot of studies that I've been reading up on about the Gardasil vaccine, and there's just a lot of issues going around with that vaccine causing autoimmune disorders as well as like gastroparesis, and there's like a whole website that is just strictly off of Gardasil. Now, for me personally, I've been a huge person. I've gotten every vaccine my doctor's told me to. I've done everything. I get the flu shot every year. I do everything. And the Gardasil vaccine is for cervical cancer for girls, and it was a 3-series shot. So you had it like the first one, and then you had to wait a few months, then you got the second one, and then you had to wait a few months again, then you had your last one. And my last one was done in 2008 when I moved down to Mississippi. So, I moved here in 2008, and I was diagnosed with irritable bowel syndrome and gastroparesis in like 2009-ish, 10. So it was a few years after that. You know, I'll never know if that was the cause of my gastroparesis, and I probably won't ever know. I mean, my doctors have told me that I can go through extensive genetic testing, but purposely for me, like, there really wouldn't be a point to it, because it wouldn't change anything. It's not going to change anything, you know. Gastroparesis isn't genetic. You know, my children, you know, there's no research out there saying that if I have gastroparesis, my children will have it or anything like that. Like, it's not based off of genetics. they said I could go through extensive genetic testing to see if, like, you know, something else caused it, or, you know, whatever. But I'm just gonna save myself the trouble, and I already go to the doctor enough, so I'm just like, there's really kind of no point. But there's some research coming out about a new procedure called the G-poem. And pretty much it's kind of like a laparoscopic pyloroplasty. And so it's very new. I have a friend of mine that's actually going to be in the clinical trial for that. So she was able to get into the clinical trial, and she's going to be having the procedure done. I spoke with my GI doctor about it, and he hadn't even heard of it. So I gave him the information. He was going to look it up. But he told me for my particular case that my plan should just be to do the pyloroplasty. Don't plan to do this G-poem, because sometimes these new clinical research things that come out, you know, with medical technology advancing, and, you know, now you're able to get, like, an appendectomy laparoscopically, like, you're able to have your appendix removed laparoscopically. Like, they're coming out with all these new ways to, you know, shorten your hospital stay, shorten your recovery time, and everything like that. But also with that, it comes with the risk of causing different things, you know, puncturing something, so that kind of thing. So my surgeon told me for my personal case that to just plan to do the regular pyloroplasty, either robotically or or laparoscopically. So we're just gonna have to kind of play it by ear. And I do look on different websites often to see if there's any clinical trials that I could get into, but there's really nothing close to me that I could get to for a clinical trial that I wouldn't have to, like, go somewhere and stay for several weeks. So that's kind of like my thing about that's going on. There's some research going on about different, you know, procedures that are being done, but my plan is just to stick to doing the pyloroplasty this summer, and we'll just have to kind of go from there. So a few of my doctors have recommended that I try and get maybe an emotional support dog, and so they've gotten me some paperwork on them, and they think that I would be a great candidate for one, and both are willing to write a letter for it, so that's super exciting. I haven't really, like, fully decided if that's the route I'm gonna go. I love dogs. I'm a huge dog person. I already have a dog, but she's 11. She'll be 11 in June, so we're just gonna have to kind of play it by ear, but I would love to possibly get one, so we'll just have to see. I have had a couple recent issues with my back, so I've been having a lot of bones pop in my back, and I've had back issues in the past. It's actually from teaching swim lessons, so just like the poor posture, and just like being in the water and like holding children, and, you know, holding them on my hip and that kind of thing. So I did do physical therapy for a while. I was in physical therapy. I had really bad knots in my back. So I started having this, like, popping in my back probably about 2 or 3 months ago, and I talked to my internal med doctor about it, and she wants to go ahead and do maybe a bone density scan just to kind of check for osteopenia and, like, osteoporosis and that kind of thing. So we're going to kind of just play by ear. She wants to have my surgeries done first before we do that, because, you know, I just need to have my surgeries done first, and she just wants to do everything, like, you know, do all that first. So I just saw her a few days ago, and she's referring me back to physical therapy for another consult just to see if I need more therapy or what's going on with my back issues. And she ordered more lab work. She just wants to verify that everything's good to go. If I have any deficiencies, my iron levels were a little low the last time my labs were drawn, but not low enough to where I'll need more iron infusions. So she drew more labs for that, and she's going to check everything, and then if I do need to go on, like, calcium or have more iron infusion, she wants to go ahead and correct all those things before I have surgery, because she doesn't want me to get in there and be like, oh, it's JK, you can't have surgery because you are whatever, iron deficient, or we have to give you whatever. So she wants to make sure everything is good to go, so when I get there I have no issues. So I don't know if you guys have noticed, but my light is a lot brighter, and that's because I have a lighting kit. I started selling LuLaRoe. I signed with them the end of November. I got my call January the 28th, and so now I sell LuLaRoe. So this is actually a LuLaRoe piece. It's called A Joy, and I have a Facebook group where I sell them, and I'm super excited because the month of August will be my biggest month, and I've decided that I'm going to raise some money for gastroparesis awareness. So that's super exciting because August is Digestive Tract Paralysis Awareness Month, and it's a huge passion of mine, and I really want to raise some money for more research and funding for gastroparesis research and for other dysmotility disorders and digestive tract paralysis disorders as well. So that's super exciting. I will post all that information in the link down below where you can join my Facebook group. We offer leggings and they are super comfortable. I live in them. Let me see if I can find a pair really quickly. Please don't look in my closet because it's a mess. Okay, so here's a pair. So I love the leggings because they have the elastic waistband and like the yoga band, and they're super stretchy. These actually have elephants on them. Aren't they adorable? They're so cute. So they're like super soft. Love them. I sleep in them. I wear them everywhere. These will probably be like my go-to during the summer. So I sell LuLaRoe. We have leggings, we have dresses, and I wear so much of their clothing because it literally is the best. The clothes are so comfortable, and I still feel like I'm put together and like look decent. But I sell that, so if you guys have any questions about that, feel free to, reach out to me and let me know. And I also have a Facebook page just strictly for my gastroparesis information and my journey, and I post updates on there pretty frequently, so I'll post all the information down below so you guys can check all that information out. And if you have any questions, feel free to PM me. I've also thought about going live on that page to answer anybody's questions. If they have any questions, if they have anything that I've tried that's worked, that hasn't worked, if I have any, different things that I could maybe suggest for people to try that's worked for me, and kind of go from there. So I hope you guys all have a great rest of the week. I have to go back to school in a little bit. I see patients in the clinic, so I have to go back and see a patient this afternoon, but our classes end at 10:45, and I wasn't going to sit there for like 4 or 5 hours to, just kind of wait around. So anyway, I hope you guys have a great rest of your week, and I will talk with you guys all later, and I will try and be more diligent with posting updates, because I know I've been really bad about that. So I know this is like a super kind of condensed update, but I just wanted to pop on and say hey, and that I love you all, and I thank you all so much for your love, your support, and your prayers, and I will talk to you guys all later. Bye.